Welcome to our farm presentation on antibiotics, starring Julie, Michelle, Katrina, Kim, and myself. Our first presentation clip is about... Welcome to our farm presentation on antibiotics, starring Julie, Kim, Michelle, Katrina, and myself. Our first clip is about the side effects and super infections that you get when you're on antibiotics. Roll the tape.
Scene one, take one. Did it come out?
I don't think we're going to.
Oh, what seems to be the problem today? I don't know, my stomach's been upset all day. I mean, I've had nausea, vomiting, diarrhea, and I've just been itching like crazy so bad I can't stand it.
Oh, no. Are you on any medication?
Yeah, they gave me erythromycin, some antibiotic for a respiratory infection I got.
Where are you itching?
You know.
Hey, did anyone discuss the side effects of taking antibiotics?
Well, they gave me some stupid pamphlet, but I've been on antibiotics before, and, you know, they all seem to do the same thing, so I just threw it away.
Well, that's the most ridiculous thing I ever heard. Well, one of the most common side effects of erythromycin is the eye distress, headache, and nausea, vomiting, and diarrhea. You might want to try to take your medicine with a little food. Plenty of hydration. You need to drink some water.
So you're saying all I need to do is drink some water and take my medicine with food, and all these problems are going to go away?
Well, it should help, but if it doesn't, then call the office and see what doctor can do for you.
Remember, plenty of fluids. Well, alrighty then, on to the next clip that reminds us how important patient teaching is. Roll 'em.
Scene 35, take one.
Nurse, what's wrong with my baby's teeth? They're gray. And I haven't grown in years. My whole family's over 5'8", and I'm only 3 feet tall. What's wrong with me? And I'm worried. I'm pregnant again, and I was on birth control. Are my other baby's teeth going to come out gray?
Calm down, we'll figure it out. Were you on meds while you were pregnant the first time? And how about before you got pregnant?
Well, the first time I was on, I think, a tetracycline. And the second time I was on couple months ago, I was on an antibiotic.
Were you informed while the adverse side effects of tetracycline while pregnant and taking antibiotics while on birth control?
It could have been. Probably. What's an adverse effect?
Well, when taking tetracycline while pregnant, it can turn the baby's teeth gray, and fortunately, it is irreversible. Also,
Wow, that's the craziest thing I've ever heard.
Also, antibiotics may make birth control pills ineffective. Do you have any other questions? As for you, little lady, were you on tetracycline as a child?
Yes, I was for a while. I don't know how long, but I was.
That's another adverse effect. When taking tetracycline, this may hinder bone growth. It does by taking up your calcium.
Yes, our final clip pertains to drug-drug interactions. That's the most ridiculous thing I ever heard. Well, most ridiculous thing I ever heard.
Wait a minute, roll 'em.
Roll 'em.
Scene 58, take one. Could you see it?
Here's your prescription for penicillin for your infection. And if your fever spikes, take 2 aspirin and call me in the morning. Thank you.
The NSAID and the antibiotic then compete for the receptor site.
Mine! You're right!
The right thing would have been for the RN to say not to take aspirin, as it is and the antibiotic compete for the receptor site, leaving the antibiotic free floating and taking longer for the patient to recover.
a long time. Actually, they were discovered on accident by Alexander Fleming in 1928. They can be helpful or harmful. Over the years, antibiotics have been overprescribed and the bacteria has become resistant to some of the antibiotics that we still use today. Newer antibiotics have been developed to outsmart the microorganisms that have evolved and become resistant. Antibiotics have other uses besides fighting infections. They are used as prophylactics, which is to prevent infections common in some invasive surgeries and dental procedures, where there are high risk for unfriendly microorganisms. Some people are prone to superinfections with the use of antibiotics. Superinfections occur when the antibiotics reduce or eliminate normal flora, which are needed to maintain regular function of many organs. We still need to be careful with prescribing antibiotics to prevent further bacterial resistance, and in doing so, as a nurse, we need to remember the 5 C's of caring when administering antibiotics along with any other type of drug. Thank you for watching, and I hope you had as much fun as we had making it. So long. Hit it, Michelle!